Good morning, ladies and gentlemen. My name is Suki Zo, and I am a master's student of School of Anti-Aging and Regenerative Medicine at Mount University, Thailand. Today, I would like to present about my paper titled Time-Restricted Eating for Chronic Plaque-Type Psoriasis, a prospective interventional study on clinical and lifestyle outcomes. These are the pictures of the psoriatic lesions. You can see the thickness, the redness, and the scales. The psoriasis affects approximately 125 million people globally. To get the exact assessment of the psoriatic severity, we have to use the PASI score, which includes the grading of the redness, the thickness, and the scaling. And we have also need to include the area calculation by using these online calculators. Psoriasis is driven by the interleukins 23 Th17 axis, which leads to more inflammation by the pro-inflammatory cytokines, and it can promote keratinocyte proliferation. In addition to the inflammation aggravated by the psoriasis, it is aggravated by obesity also. Obesity is also an inflammatory disorder. So, psoriasis plus obesity can lead to more inflammation and higher severity of the disease and less treatment response. So losing weight would be the key to reduce the inflammation brought on by the obesity and also the psoriasis. Psoriatic patients are also suffering from the lack of sleep. That lack of sleep can also lead to a worse quality of life. The itchiness caused by the psoriatic skin lesions can disturb the sleep, and in turn, sleep impairment can release the cortisol and cytokines, causing more inflammation. So, psoriasis plus poor sleep can lead to more inflammation and lower quality of life. Of all the weight loss strategies, the diet protocols are the cheapest one. Of all the protocols, I have included the daytime time restricted eating, which is restricting to eat only the timing. 8 hours of calorie, no calorie counting. They can eat as much as they want in the daytime, but they have to fast for 16 hours in the nighttime. Only water and green tea or black coffee are allowed. The TRE can regulate the circadian rhythm, optimize the metabolism, modulate the immune system, thereby improve the sleep quality, reduce the weight and visceral fat, reduce the inflammation, and thereby reduce the psoriatic severity. So the patients can have a better well-being and enhanced quality of life. So we have conducted the 12-week long TRE protocol and in 18 chronic plaque psoriatic patients. And the patients who are taking the systemic medications for the psoriasis are not allowed to include, and other variant psoriatic patients are not allowed, and other patients with underlying uncontrolled diseases are not allowed, and pregnancy is also not allowed. These are the statistical tests that will be used in this study. And this is the trajectory for the PASI score. The mean PASI score dropped by 3.21 points from baseline to week 12 with a substantial effect size. These are the pictures showing the improvement in the psoriatic severity. You can see the lesions on the belly are reduced, and also the distension of the belly is significantly reduced. These are the weight loss parameters showing all of them showing downward trends with large effect size. These are the categorical changes in sleep quality and quality of life. Patients were asked whether they are satisfied or not. 67% were moderately satisfied and 28% were very satisfied. So 11 out of 18 participants were able to reduce their weight more than 5% of their initial weight. That is why DRE can modulate the edible dermatological axis by reducing the visceral fat, and by promoting the lipolysis, TRE can reduce the systemic inflammation which causes the psoriatic plaques. And TRE was well tolerated with only mild temporary side effects like hunger, fatigue, and constipation. These symptoms reflect the metabolic inflexibility during the adaptation period. So, the safety and feasibility are demonstrated through this the study. There were limitations, the small sample size, absence of non-control group, but the observed significant improvement suggests a meaningful trend. So that this 12-week daytime TRE demonstrates significant improvement in patient outcomes, and dermatologists can integrate TRE into their standard care protocols as mentioned below. And for the future, the larger scale, longer term randomized control trials are needed, and they should include the testing of the parameters like insulin sensitivity and inflammatory markers. Thank you very much, and I am very honored to be able to participate in this conference. Thank you very much.